Hello, this is Dr. Soheila Rostami. I'm an oculofacial plastic surgeon, double board certified. I've been talking to you about my journey through my career. This is the 25th year, I can't even believe that I say it, that I have graduated from my fellowship in 2000 and started my career. And as I mentioned to you guys, I graduated from University of Maryland. The last graduation was from University of Maryland doing my fellowship in oculoplastics. As I mentioned previously, oculofacial plastic surgery is a subspecialties in ophthalmology. Many of you, even my close friends, they don't understand what does that mean. So I thought I should mention and clarify what does oculofacial plastic surgeon is. We go through fellowship, we go through residency, we go through internship, and we go through medical school. These are from medical school up. So a lot of training goes into creating an oculofacial plastic surgeon. So you go through med school. Usually, I don't know if I'm included in that, but usually the ophthalmology, ENT are early matches at the time that I went through school. I don't know what it is now, but these are early matches. What it means that during your third year medical school, you apply for early matches. And there are specialties that they usually pick the cream of the crop, I guess, sort of. So they want the top of the classes of med school. So usually ENT, ophthalmology used to be, I don't know if that's the case now, but that's when I went through and this is how it was. And so they're very competitive. So that's why it's early match. So if you don't match, then you can go through the regular match and apply for other specialties. So I was lucky. I got accepted in the program that I wanted, and I went through Howard ophthalmology program. I have to say that I'm very proud being part of Howard Medical School and residency program. They have very strong medical school and training and residency. I believe that I got a very good education there. So that's how it was. I got full scholarship from med school, and the residency, usually they want their top residents for their own. So majority of the schools, they really want to pick their own best students, I guess. And that's how it was for us. So I went through the residency ophthalmology, but tell you the truth, I never wanted to be a general ophthalmologist. So even when I applied for ophthalmology, I knew that that's not what I want to do, and I want to be an oculofacial plastic surgeon. I knew about the subspecialty of oculoplastic in ophthalmology, because I'm very, from the beginning, I wanted to be a surgeon. And as I mentioned to you guys previously, I experienced the surgery when I was a very little girl. I wanted to be like Dr. Durandish. So that's what my dream was. So I wanted to be a surgeon. I was fascinated with the face and eyes. So I didn't want to do just cataract. And since ophthalmology is part of the surgery department, I knew that I can go through that and become an oculofacial plastic surgeon. So that was the whole goal. So I did not want it to be a cataract surgeon. Everybody in ophthalmology department knew that. So they knew that I wanted to go through ophthalmology to get somewhere else. So even during my residency, my director, Dr. Copeland, rest in peace, he was an amazing gentleman. He kind of helped me to create some of the rotations at Howard for myself to do more oculoplastic. I worked with a couple of really nice surgeons. Dr. Citron, I love him and I respect him. He taught me a lot. Dr. Kidwell was my oculoplastic director at Howard, and Dr. Kidwell taught me so much. I really appreciate every person that influenced me to become who I am today, and he was one of the major influence on my career. Dr. Kidwell, I love you. I respect you very much. So that's how I did the minimal possible for graduating from ophthalmology. For cataract and glaucoma, my focus was oculoplastic. And many of my resident fellows helped me to get that. So we kind of switched. Okay, you don't want the cataract, you want your oculoplastic. So we would switch. So we did a lot of surgeries, kind of vice versa. I would do their cases, they would do my cases. And I applied, and then again, oculoplastic is an early match, so you have to apply for oculoplastic programs, and they kind of you have to it's either 2 years odd numbers or 2 years even numbers programs, and at that time there were 1-year programs as well. So I got accepted to the program in University of Maryland, and I finished in 2000. So it was the millennia. So I remember that 2000, all were scared of what's gonna happen. So it was a very interesting year to graduate and start your career. So that's the process of becoming an oculofacial plastic. Now, what do? We don't do anything with the eye itself. We do everything that is related to the eye or surrounding the eye. So that's what oculofacial plastic surgeon does. So that's why we kind of are facial surgeons, because we kind of are able to lift the eyebrow, deal with the eyelids, deal with the orbit, fix the broken bones, deal with cancers around the eye, reconstruct the face. And that's why we learn to do facelift, mid-facelift, and facelift to be able to create the lower eyelid. And so it's a lot of reconstructive surgery. And so that's why it's so easy for us to kind of transition into cosmetic. Many of the reconstructive surgeons are that way. We are easily can transfer into cosmetic surgeon. At the time that I went through residency and fellowship, there was no such a thing as cosmetic trained individual. Now these days we have fellowship. So you can go through your trainings in ophthalmology or surgical trainings like general surgery, plastic surgery, ENT facial, oculofacial, and then take a fellowship in cosmetic surgery. This is new, so we didn't have it at the time that I was graduating, but as I mentioned to you, the past 25 years has been extreme advances in cosmetic, and so now we have the need to have the cosmetic fellow trained. So I am one of the trainers for fellowship in cosmetic surgery. So we have people apply through American Academy of Cosmetic Surgery for the fellowship, and they go through 1-year fellowship training. So usually they're already surgeons, so they just wanted to refine their skills in cosmetic. So I did a lot of reconstructive at the beginning of my career. I worked in trauma center at Fairfax. I worked with many of my colleagues to reconstruct the trauma faces, whether it was gunshot wound or accidents. And then during the, as I mentioned to you guys, I always were fascinated by cosmetic procedures, and as I mentioned previously, the gateways to our starting cosmetic for ophthalmologists and oculoplastics was the Botox. At that time was only Botox. So we started with doing neurotoxins for cosmetic purposes because it was so easy for us to transition to cosmetic, because we used to do it for functional patients, for blepharospasms and for hemifacial spasm patients. So then, because the same companies were, Allergan started to creating the fillers, so they will approach us for the fillers as well. So for me, it was very easy to transition even from day one when I started my career. So I've been doing this for 25 years. Now, why did I bring this up? Because a lot of people think that I'm an ophthalmologist. Why am I doing cosmetic? So no, from day one that I started my career, I was an oculofacial plastic surgeon. I relied on referral from other ophthalmologists that they knew what I do to recommend patients to me, to come to me to have surgeries. And then even at that time, I would do the surgeries, functional and necessity surgeries for them, and then I would offer them some cosmetic procedures at the same time. So I've been a reconstructive cosmetic surgeon from day one when I started my career. Now, as I mentioned, cosmetic fellow trained individuals is a new specialty, so it's nothing that has been around for a long time. I believe that we started fellowship training from AACS for the past maybe 8 years. I'm not exactly sure, but I can find out how many years we've been training fellows. Now, plastic surgery groups are also trying to create fellowship in cosmetic as well. Now, why don't we have fellowship in cosmetic? Because many of the training facilities or hospitals and universities are related to the hospitals that accept insurances, and they are funded by government or by states for that reason. So a lot of cosmetic procedures are not covered or provided by those centers. So you don't even consider to have residents and fellows do those kind of procedures, because it's not even offered at the hospitals, at those settings, in those kind of university-based hospitals. So there's really no opportunity for the resident or fellow to get to see those kind of patients. So that's why it's kind of like separated from teaching organizations to kind of have those kind of opportunities for cosmetic procedures. But now, because there is a need for it, now they're considering to kind of have that rotation of cosmetic for dermatologists, for plastic surgeon, for oculoplastic surgeons, for ENT facial specialists. So now they're adding kind of those kind of necessities in cosmetic for trained residents and fellows. So it's a very new kind of events happening in our world in medicine for cosmetic needs. So I think that many changes are happening as I'm speaking with you. Now, a lot of cosmetic providers, now let's say, now we are surgeons, cosmetic surgeons. Now, there are so many cosmetic providers out there that they're doing minimally invasive procedures, including fillers and neurotoxins and lasers. These providers, how do they get their trainings? There's really no standard of care to teach any of these people how to do certain procedures. Everybody from their mothers till now, they're now creating certificates. And I don't know where they come from, what these certificates mean, but they take 1-day course, maybe 3 hours, and they become certified injectors. And you can be anybody. So now you have to be very careful who you choose to be your injector. So there are nurses, PAs, in some states even aestheticians. Now, I would trust a nurse more than an aesthetician to do my injections, but I won't trust anybody anyway. You have to really look at their training, how long they've been trained, what they have done to get trained. So, and that's why a lot of states now questioning how to standardize the training of these individual providers. There's so many out there now. They're making so much money by creating these 2-day courses or 1-day courses to train people. There are training by the companies as well. So Galderma, Allergan are also, and also other companies have their own trainers, and this is how the industry has been working, by just training injectors to do injections. I believe what has happened in the past now catching up with them, and now is biting them in the back, because many of these injectors were not very well trained, and so now we have train wreck injected faces. And it's not just the complications, it's just the overfilled faces and unusual faces. And now if you look at social media, everywhere in social media is a negative view of fillers. I really don't believe that. I think the fillers are not to blame, is the injector to blame. And the way the whole industry has approached the training, and the way they sell the products, and the way they're making money off of it. So there is no standard for injections. So you can be just a PA graduating just 2 days ago and take a course and start injecting. Or, as I said, in some states, even you don't even have to be a physician assistant. You can be an aesthetician and do the injection. So I don't know where we're going to go from here, how they're going to control this, and how they're going to manage this. But I thought you should be educated about it and know and understanding what's going on. So question who is doing this for you. Make sure you understand who they are, how do they get trained, and then if you chose the wrong person, don't question why this went wrong. It's because, well, you didn't do your due diligence and you didn't do your homework. So just make sure you know who they are and what they're doing. So I'm going to discuss a little bit further of what are the different fillers and what you should look for in the person when they do injections for you. We're going to discuss this further. Thank you. How long did it take?